Welcome, everyone. My name is Ashwin Mehta. I'm the Staff Service Manager of the Department of Healthcare Services of Licensing and Certification Division. Thank you for joining this training on the new LPS Data Reporting Platform. Next slide. This training is meant for county behavioral health directors and staff who will be submitting data on their behalf. This new platform is designed to improve data reporting and accuracy for LPS data requirements. This has been a cross-divisional effort at Department of Healthcare Services, and I am joined today by Brian Fisher from the Program Data Reporting Division and Latza Bulyan Pragada from Enterprise Technology Services, who will walk us through this new platform. Our goals for today are to provide counties with an overview of SB 929 requirements for data reporting, to provide an update to counties of the SB 929 phase-based implementation plan, to provide an overview of the new data reporting platform and discuss differences and updates from Nintex, and to walk through the new electronic data reporting platform. You all play a critical role in this work, and we appreciate your time and effort in learning this new system as we continue to improve data reporting processes. Next slide. SB 929 and AB 118 are revisions of the LPS Act with the goal of improving data reporting and service transparency. Both bills expand DHCS data reporting requirements from counties, LPS designated facilities, and other entities responsible for implementing 5150. SB 43 modified the Welfare and Institution Code to expand the definition of gravely disabled from only mental health disorders to now include individuals who are determined to be gravely disabled as a result of severe substance use disorder or both a co-occurring mental health disorder and a severe substance use disorder. Next slide. For our phases of implementation plan, these phases have been updated to accelerate implementation. Phase 4 now incorporates data previously in Phase 5. And now passing it on to Brian.
It contains information designed to inform the submission of LPS-related data to DHCS and is regularly updated with each implementation phase. The DED includes data variable descriptions and a glossary of terms. And DHCS continues to update the DED to accommodate the addition of new data elements according to the phases of the implementation plan. For example, the latest update to the DED incorporated the data elements added as part of Phase 4 of the implementation plan, which included data element 6 related to clinical outcomes, data element 8 related to waiting periods, and data element 9 related to source of admission. Users should also notice that the data dictionary format has been revised to comply with the DH approved report template. Next slide. Before we begin the walkthrough of the platform's data reports, I want to take a moment to discuss a reporting concept that DHCS is now asking users to follow when they report their LPS data. Specifically, this reporting concept applies to all of the data elements except for the total count located at the beginning of each hold category within the platform. Total count data should include the total number of all instances of each hold category. Persons detained and or admitted involuntarily more than once in a hold category during the quarter should be counted each time for the total count. Please apply this concept to all demographic data elements. The age group is simply an example in this case, since it is most likely of all the demographic data elements to change. Included in this slide are two common scenarios that I'll use to illustrate this concept. In scenario 1, we have the same person, the same hold category, the same quarter, and the same facility. If the person was either detained and or admitted involuntarily in the same hold category, for example, 72-hour detainment, more than once during the quarter, only count this person once in the demographic data elements and report the most current demographic data available. The example on the left illustrates the first reporting scenario. In this example, person A had two separate 72-hour detainments in the same facility during quarter 1. The 72-hour detainment total count would equal 2. Person A was recorded in the 25 to 44 age group during the first hold, then recorded in the 45 to 64 age group during the second hold. County should only report the most current demographic data for this person. In other words, report the demographic data collected during the second 72-hour detainment. Scenario 2 is similar, but it's the same person with separate hold categories in the same quarter, in the same facility. If the same person was either detained and or admitted involuntarily in separate hold categories, for example, 72-hour detainment and then a subsequent 14-day treatment during this quarter, count this person once in each hold category in the demographic data elements and report the most current demographic data available. The example on the right illustrates this second scenario. Person B had a 72-hour detainment and a subsequent 14-day treatment in the same facility in quarter 1. The 72-hour detainment total count equals 1, and the 14-day treatment total count equals 1. Person B was recorded in the 25 to 44 age group category during both holds. County should count the person B's demographic data once in each hold category, both the 72-hour and the 14-day treatment. In this case, person B will have their 25 to 44 demographic data reported in both hold categories, 72-hour detainment and 14-day. Now I'll hand it back to Ashwin.
Moving on to the electronic data reporting platform. Please remember that a representative from the County Behavioral Health Director's Office is responsible for the submission of quarterly reports for reporting requirements. These quarterly reports should be submitted by the 30th of the month following the end of each quarter. The submission period for each quarter of data will be for 30 days. For example, the data reporting platform opened on July 1st, 2025, and will close on July 30th, 2025. The data collection during this time frame will be from January through March 2025. The information provided in these quarterly reports will be incorporated into an annual report as required by the California Welfare and Institution Code, Section 5402A. Links to an instruction page will be available in the attestation module of the reporting platform, and if you need assistance preparing these reports, please call the Department of Healthcare Services at 916-323-1864 or email at mhdata@dhcs.ca.gov. Passing it back to Brian.
Thank you, Ashwin. But lastly, before we begin a walkthrough of the platform and its modules or components, I want to take a moment to provide you with a summary overview of DHCS' new reporting platform. To begin, the new platform has a different look and feel than the Nintex application. The new platform is designed to be more user-friendly, yet still follows a similar logic and process flow. It's important to remember that each platform session will time out after a period of 20 minutes of user inactivity. However, you will be provided a timeout notification before that happens. One of the most important enhancements available in the new platform allows users to save their work without completing a data report. Previously, users were not able to save their work and would have to complete a data report before quitting the session. DHCS strongly recommends that users utilize the Save as Draft button if they anticipate needing more than one session to complete a report. Using the Save as Draft button option saves your data entry as is without sending the data report through the platform edits. The Save and Continue button should only be used when the data report is completed and ready to submit for processing, because the data entry will be edited and invalid entries will be highlighted for users to correct. Once a data report is completed and submitted, the Review and Print button becomes active and allows users to review and download a PDF of their data report. Within each report, radio buttons for No and Facility Did Not Report allow users to complete the data report without having to enter any data. The navigation has been improved to allow users to always know which stage in the the platform they are in. Icons allow users to identify the module they're in, and once a module is completed, the next icon becomes active and allows users to select it to proceed to the next module. Counties with LPS facilities, including LPS jail facilities, will have their facilities listed within an entities table that allows for scrolling and filtering. The table also provides data report statuses such as not reported, in progress, and completed. The platform's final module, Review and Submit, allows users to review the data entered and to download a copy of the data prior to submitting their report. Finally, the home banner at the top of the screen allows users to access and download the data reporting platform user instructions at any time during the session. Now I'll pass it to Lata.
The LPS Data Reporting Platform is hosted on DHCS portal. To access the platform, user process for identity verification and access authorization. Access is restricted to authorized users only, specifically county behavioral health directors and their designated representatives. To begin the DHCS Azure registration process, please check your email for a message from DHCS, California Department of Healthcare Services Organization, and click the invitation link to accept. Users can refer to LPS User Manual Azure registration process previously shared by DHCS to complete the setup. This manual provides step-by-step instructions to help ensure the registration process is completed smoothly. Once registration is complete, users can access the DHCS portal directly using multi-factor authentication and begin using the LPS data reporting platform. Now I will pass it back to Brian, who will guide us through a walkthrough of the platform.
Thank you, Lata. The first module I'm going to show you is the attestations module. This is where users must certify their status as an authorized submitter, for example, a county behavioral health director or designee responsible for the submission of quarterly data reports. A link to the platform instructions is included here. Please take a moment to download the instructions if you haven't already done so. You may find it helpful to have a copy nearby as you complete your reporting. So affirm your status by checking or activating the checkbox. Once you've done that, the contact information module and the next button will be activated. You can select either one to proceed to the contact information module. So at the contact information module, please ensure that your information is accurate and up to date. This information is used by the platform to send confirmation emails after completing your data reports. DHCS also uses this information for county outreach. I'm using this county here to walk through. And so next you can select, after the contact information is accurate and up to date, select the next button or the new or update icon to proceed to the next module. This is a module where users will see pre-populated fields such as the county, the data submission period, which reflects the currently active period during which counties are required to report these data, typically 30 days in length. This will say July 1st through July 30th, 2025, when the application platform is active. You'll also see the year and the quarter of the data currently due. Next, you'll select a data report from the dropdown. We have all three reports here: summary of persons admitted or detained in LPS designated and approved jail inpatient units, a summary of persons admitted or detained in LPS designated and approved facilities, and then a summary of persons detained in other entities. So after you select the data report, the platform will generate an entity table. This table will be pre-populated with any associated facilities for the county on file with DHCS. After selecting a data report, you'll have the ability to activate both the next button or the SB43 process flow icon at the top of the page, either of which can be selected to proceed. So next is the SB43 module. In this module, you're required to confirm via yes or no radio button whether or not the county has implemented SB43. You'd select yes if your county has implemented 43, or no if your county has not yet implemented Senate Bill 43. After selecting yes or no, both the next and the data report button will be available to select to proceed to the next module, the data report. Remember from our walkthrough in the data report screen, users will see the county reflects the reporting county, the year and quarter reflects the year and quarter of the data currently due, the data report reflects the data report being completed, and the entity reflects the name of the facility. Next, you'll see standard guidance about the LPS reporting requirements, and also note the asterisk, which denotes required fields. Below this, you'll see each of the applicable data categories required for this data report. You are required to complete each of the data categories. For example, I'm going to illustrate scenario 1, which is illustrated here in this report for 72-hour admissions. This is the same person, same hold category in the same quarter. The total count is 2. The demographic data is reported as collected during the second 72-hour hold. So each category, data element category, has to be completed, whether there's data or not. So you can see I've entered the data here for this one scenario, completing all of the fields. Note that we've changed the primary language so that not all of the fields are required. You only need to select the field that you have language to report data for. And then complete the categories within this hold category. Note that the platform does not validate the data that you enter, except to ensure that the values you enter are numeric and do not exceed 7 digits. So you complete all of the hold categories, making sure each one is completed. I've only filled out the first one just for sake of time to show you how to enter that. Most of these would normally have data and you'd be entering them as you did in the first category. Be sure to complete the summary of county contracted beds, enter that number, and then at the bottom of the screen, you'll find the Save as Draft and Save and Continue button. The Save as Draft button can be utilized anytime during the session. Data entered will not be validated, but will be saved for later completion. This allows you to save the completed data entry and return to complete the process at another time. The Save and Continue button should only be selected after a data report has been completed and is ready to be validated and submitted. Now I'll walk through the next report, the LPS Designated and Approved Facilities report. Go back to New and Update. Select the Designated and Approved Facilities report. Notice the report statuses here. You've got a selection of reports that have not been started. We've got 1 in progress, 1 submitted, 2 in progress, and 1 submitted. So now we'll walk through one of these reports. Again, a county with at least 1 LPS designated and approved facility will display the facilities or facilities listed in this entities table. The first time you access the report, these statuses will be not reported. But if you believe that the information for your county for facilities is not accurate, please contact DHCS. So first you would select the facility you're wishing to complete report for and select next. You'll be taken to the SB 43 module, complete that, select next. So here again, you'll see the county, reporting county, the year and quarter of the data being reported, the data report, and the name of the entity being reported. Again, the standard guidance about reporting requirements and the indicator for required fields. But then you'll see all the applicable hold categories for this particular report. You're required to complete each of the data categories. And in this scenario, or in this report, I'm going to demonstrate scenario 2, which is the same person, separate hold category, the same quarter, and the same facility. So here we have that scenario 2 illustrated. There's a 72-hour evaluation and treatment and a 14-day. So they're counted once in the total count, and then the demographic data is reported. All the fields are completed where required. Language, only the language that you have data for is required. Complete all of the applicable fields. And then within each hold category, make sure each hold category is completed. Oh, excuse me, this is the 14-day. So here we have the 14-day total count of 1 with the data reported in each of the applicable data elements for this hold category. Each of the remaining categories are completed. And please always be sure to enter the summary of county contracted beds for the facility. Then you can save as draft or save and continue. Remember, only save and continue if you've completed all of the data entry and are ready to send the report through the edits. Point to save as draft, and also show you the summary of persons admitted or detained in other entities report. Back to the new or update module. Selecting the summary of persons detained in other entities. In this scenario, the county has at least one other entity. The counties are required to complete a separate report for each of their other entities. Remember, the primary difference between this module for other entities is that DHCS does not maintain a list of other entities operating in each county. Thus, there's no listing of facilities from which to choose. There are additional values that you will need to select and enter for this data report. From the other entity dropdown, select the appropriate type of other entity. After you do this, other entity name and other entity address data fields become open for you to type in and enter the appropriate information. Please ensure accurate spelling and address information for the other entity. Select Add Other Entity once you've entered the data in the other entity name and other entity address. When you add this entry to the entity table, the entity's report status will reflect not reported. And the last update field will be blank. In this case, I'm going to demonstrate a report that's already been completed or is in process. I'll select Next to move to the SB 43 module. Select Yes or No for the county radio button for implementation of SB 43. Here again, users will see the pre-populated fields for county, year, and quarter being reported, the data report, and the entity name. And next, you'll see again the standard guidance about LPS reporting requirements. And below this, you'll see the applicable hold categories for this data report. You're required to complete all of the data categories. So in this example, I've just have a total count of 72-hour assessed detainments of 1. Just completed the report as I've shown you in the previous examples, making sure all the data fields are complete. Primary language, only have to report the data that you have, or the category you have data for, excuse me. Completing all the data fields. Making sure all the data categories are completed. Summary of county contracted beds for this other entity. And in this case, I'm going to save and continue. Select the Save and Continue button if you've completed all the required data entry and are ready to review your data prior to submitting the data report. This will generate a data validation step to ensure all required fields are completed. If the validation is successful, you'll be taken to a Review and Submit module. Remember, the platform only validates to ensure the data are numeric values not exceeding 7 digits and that all data categories have completed properly. Now we'll walk through a Review and Submit module. So after completing a data report, module users are taken to the Review and Submit module. Users will see the following pre-populated fields. The county reflects the reporting county. The year and quarter reflects the data being reported. The data report is the report being completed, and the entity is the entity name that you're reporting data for. To review each of the categories to ensure that values reflect the information you provided during data entry. Review the summary of county contracted beds to ensure the count is accurate. At the bottom of the screen, you'll find the Print PDF and Submit buttons. The Print PDF button allows you to save a copy of your data report in Adobe PDF report form. You're encouraged to make use of this option for your records. The Submit button should only be selected after you have reviewed and approved the information shown in the Review and Submit module and the Adobe PDF report. If you're ready to submit your report, select the Submit button. First, I'll show you the Print PDF, which will allow you to download a copy of the report. Basically, is the same format as what you see on the screen here. And next, I will submit the report. After submitting the report, the platform will confirm your reporting in a dialog box that confirms receipt. You will also receive a confirmation email that provides you with a confirmation number. Select OK to proceed. Finally, I'll walk you through updating a submitted report. So back to the new or update report. I'm going to update the other entity report that we just completed. That was for Mobile Crisis 2. So I'm going to select Mobile Crisis 2. So to update a previously submitted report, you must navigate back to the new or update module. There you can select a report to update. After selecting the report, press the Next button or the SB43 icon to proceed. Oh, sorry. The platform generates a pop-up dialog box that asks users, are you sure you want to update an already submitted report? Yes or no. Select yes to update the report. Next, you'll be taken to the SB43 module to begin updating the report. Confirm or update the data. Select next to continue to the next module. In the data report, users can review their previous entries and update accordingly. I'm going to change the number of summary contracted beds to 15. And then save and continue. Save and continue to complete the update process, and you'll be taken to the Review and Submit, where you can check to see if your update has been accepted. It has. You can print PDF again from here of your new updated report, or you can send the report through the submit process and complete your reporting.
Thank you for that, Brian. And thank you everyone for watching this training. If you need assistance in preparing these data reports or do not see the facility listed for your county, please call us at Department of Healthcare Services at 916-323-1864 or email mhdata@dhcs.ca.gov.